Hi, my name is Judy. I'm going to be doing an indwelling catheter insertion today. I have my GPSPs being done, my 11 rights. I reviewed the patient's chart of any limitations of physical activity. I've confirmed the medical order for the indwelling catheter insertion. I've gathered up my supplies and equipment, and then I'll obtain assistance from another staff member if necessary. I'll perform my hand hygiene, and then I would put on my PPE if indicated. I would ask the patient if they're allergic to latex or have any other allergies. Explain to my patient about the procedure. Ask if they're having any pain. So right now I'm going to go ahead, do my hand hygiene again, and we'll put on my clean gloves. Now I'm going to do perineal care on my patient. Got my warm soapy water sitting aside and my rinse water. So I'm going to grab my wash rag, soapy wash rag. I'm going to pull the labia back. I'm going to do one side, front to back, downward. Turn my rag around. Do the other side, front to back, downward. And do the medius area, just above the medius, down towards the rectum, washing it. Then I'm going to dispose of that wash rag, and then I'm going to get me another rinse rag. Okay, and I'm going to wipe it down. Switch sides. Wipe this other side down. Switch sides again. And dry it. And wash rag. Dry one side. So rag around. Dry the other side of the labia. And then dry from above the medius down towards the rectum. And then I'm going to take off my gloves, and I'm going to perform my hand hygiene and get my sterile field ready and my sterile gloves. So I'm going to bring my sterile kit over here. I've already got a protective chuck underneath my patient. So I'm going to drive from 1 inch back, only touching the tips, peel back 1 inch, touching 1 inch, pulling back, grabbing the tip, peel out, and peeling out. Sorry, I'm sliding it over by the tips. Okay, I'm going to do my hand hygiene again. And then I'm going to put on my sterile gloves. Only touching the outer tips. Touching up underneath the edges. And then grabbing my glove, make sure I grab it, bend over, not over on the other one. I'm grabbing my glove from grabbing the outer part of the cuff, and then putting on my sterile glove. Not touching the part, only touching this part. Okay, now I'm going to take my 2 fingers And then I'm going to take my 2 fingers up underneath the cuff. Only touching like so. And we'll put it in my non-dominant hand. Or on my non-dominant hand. I'll fold it back. I'm going to take my finger, my 1 finger, get up underneath the cuff, and fix it like so. Now my hands are sterile, and I can set up my sterile field. So I'm going to take out my lubricant. I'm hoping you guys can see all this. And I'm going to put my lubricant on my tray. Open it up. Put it on my tray. Dispose of it. Keeping my hands up like T-Rex all the time. Take out. Open up my antiseptic swabs. Take them out of the pack. Lay them on this tray. Dispose of it. Keeping my hands up all the time. Okay. And then I'm going to take my saline flush solution. Take my cap off. Toss it. Not going over sterile field at all. Okay. And then I am going to pull this back here. And I'm going to add my flush in there. And then lay it back in the tray. Okay. And now I am going to take out my catheter, and I am going to lubricate it. Take my hands up, dispose, get rid of it. I'm going to take my catheter and I'm going to lubricate it 1 to 2 inches in there. Probably 2 to 3 inches back. Lubricate it and lay it in my tray like so. Open it to stay there. Okay. Then I'm going to take my swab, antiseptic swab. I'm going to grab a hold of the patient, my finger, my thumb, pull back the labia. I'm going to pull her back a little bit so maybe y'all can see. And then I am going to, not going over the sterile field at all. Matter of fact, I'll pull back the sterile field, so just to make sure. I'm going to take and my swab, go one side down, like going over my sterile field, dispose of it, take the other side, go down, dispose of it, take this side, swab, go from the medius down towards the rectum, come back and toss it, keeping my finger and thumb with the medius pulled back. I'm going to take my lubrication, and now I'm going to hold it 1 to 2 inches or 2 to 3 inches back, and then I'm going to insert it slowly, insert it. Two to 3 inches. Until I see urine draining. And once I see urine draining, I am going to advance it 2 to 3 inches more. If I have any resistance, I'm going to ask the patient to breathe. Take a deep breath in, and then I'll rotate the catheter gently to finish getting in, if I have any resistance. But I don't have any with this patient. So I'm going to put it in, and then I am going to take my fingers and hold the catheter. And then I am going to get my flush. And then I'm going to open up the balloon inside. So I am pretending that I am flushing, or putting this all the way in, 10 cc's in, to open up the balloon inside. And then I will pop this off, toss it, and the balloon's deflated or inflated. So I'm going to check my patient, remove my fingers from it, check my patient for resistance. No resistance. So now my gloves are considered clean instead of being sterile. So I'm going to remove my catheter back. For my patient, from the pit, dispose of it. Keeping my hands above at all times, not letting it down. And then I'm going to take my catheter back, and then I'm going to take my catheter, or I have a catheter strap that I am going to put the catheter to on the inside of the leg, which I have the catheter strap on. If you could see it, the catheter strap is actually on my leg here. I will put it on the inside. So strap it on the inside of my leg and lay it off the side of bed onto the railing of the bed. Make sure there are no kinks in it. So I strapped it. And I can also take the clip and clip it to the bed. Leave enough room when I strap it to where if the patient needs to move or anything like that. Just make sure I leave enough room for if the patient can be able to move around and it not pull the catheter out. And at this time, I am going to take my gloves off. Oh. Okay, I'm going to do my hand hygiene. Then I'm going to clean up any of my mess, dispose of it, and then I am going to go do my documentation. I'm going to go check for I'm going to document for color or any abnormal findings. If, this is something I forgot to tell you, if the doctor needed a sample, okay, if he needed a sample, I would go ahead and get a sample from the clean cath bag, because that'd be the only time that I can get a sample from it. So if he needs one, I would go ahead and get it. A specimen. So I would do any findings. I would do, I would check for color of the urine, any abnormal findings, and I would go document how the patient reacted to everything. And if there's anything else that I needed to do, I would do it and write it in my documentation. Thank you very much. I hope I did a good job. Nervous, but I did best I could.